This is ear speculum. Ear speculum is usually used for examining the external auditory canal and the tympanic membrane. The purpose of ear speculum is to push the hairs to the side when there are hair in the ear external auditory canal. Secondly, if you are doing suctioning, so it will keep the walls of the external auditory canal safe from injury. Frazier's suction tip. This is used for suctioning from the external auditory canal, for the suctioning of wax, for the suctioning of pus, for the suctioning of any kind of discharge blood from the external auditory canal. There is a hole which you are going to press during the suctioning, which will create a negative pressure and which will make the fluid suck through a hair and into the suction machine. This is called as Jobson horn probe. Jobson horn probe can be used both in the nose and the ear. The main purpose in the ear is you put a cotton over here and you probe for any mass which is non-bleeding. You just probe for the mass and you use this end for usually taking out suction wax or any foreign body which is present. You can use this end. Ear hook. Ear hook is used for the removal of foreign bodies. Usually you have to identify it from the tip. There is a very fine tip which goes beyond the foreign body and you simply pull out the foreign body outside. Forceps, you have to identify crocodile forceps from the tip. It is also called as alligator forceps. It is used for the removal of foreign bodies like paper and which can be grasped easily from the external auditory canal or the ear. This is called as meringotome. Meringotome is used for incising the anterior inferior quadrant of tympanic membrane, usually in when you want to proceed with the meringotomy. Some people prefer the anterior inferior quadrant while some people prefer the posterior inferior quadrant. This is called as Mollison's mustard retractor self-retaining. It's called as self-retaining because it retains by itself. It is locked over here. You do not need an assistant to keep it open for you. It is locked over here. Mollison's mustard retractor is used when you give an incision on the posterior auricular region and you need to go to the mastoid through the McEwen's triangle. You put the Mollison's mustard retractor. Otoscope. Otoscope. Simple otoscope. This is called as simple otoscope. We have got another otoscope that is called as pneumatic otoscope. Simple otoscope is just used for the magnification of the tympanic membrane. It can give you a good idea of the tympanic membrane and any condition, usually otitis media, acute otitis media, or any perforations or any disease beyond the tympanic membrane. There is an opening on the otoscope. Usually this opening is used for to give pressure to the tympanic membrane and to assess whether the tympanic membrane moves or do not move, like in conditions like otitis media with effusion. Most important thing for nasal examination is headlight. Each and every individual student should have his own headlight for examination. Headlight. This instrument is called as tongue blade. It is also called as lax spatula. It is also called as Doyen's blade. It is used for depressing the tongue while examination of the oral cavity. It is also used for mist test in nasal examinations. Killian speculum. Killian speculum is used for nasal examinations and usually during septoplasty and SMRs. It should be held like this. St. Clair Thompson's posterior rhinoscopy mirror. There is a bend in between which is going to differentiate between ideal mirror and posterior rhinoscopy mirror. Posterior rhinoscopy mirror is used during the procedure of posterior rhinoscopy. Ideal mirror. Ideal mirror is used for indirect laryngoscopy. Always remember there is a bend in the posterior rhinoscopy mirror and there is no bend in the ideal mirror. Always remember in ideal you have to examine the larynx, so the mirror should be down. In posterior rhinoscopy you are examining the posterior choana, so the mirror should be looking up during examination. Boyle-Davis mouth gag. You are going to be asked to assemble this instrument. Boyle-Davis mouth gag is used during tonsillectomy. Always remember to hold it from the distal end. Put your thumb over here. In the left hand, put your thumb over here. Take the tongue blade in the right hand and simply insert it over here and close it up. Then remove the thumb and you can put it in the mouth and open it out for tonsillectomy. Remember that this portion should be pressed only during insertion of the blade, and it should be left open while taking the blade forward. Posterior nasal pack used for posterior nasal packing. It should always be lubricated with BIP solution, and it is inserted through the oral cavity. One prong should be on the side of the mouth, and the two prongs should be coming through the alternate nostrils, and it is attached to it. For insertion, usually Foley's catheter is used to insert into the oral cavity. Catheter. Some people now prefer the Foley's catheter for posterior nasal packing. The Foley's catheter is passed through the nose. This part is lubricated and passed through the nostril, and it is taken to the nasopharynx. Fluid or air, preferably air, is given over here. The balloon expands in the nasopharynx, and the posterior choana is blocked by the balloon of the Foley's catheter. St. Clair Thompson's adenoid curate, without guard and with guard. The reason it is called as with guard is having this sharp teeth. You can remove the guard by simply lateralizing this and taking it up. You can remove the guard. You will be asked to put the guard back. The first step is to flex it back, put it over here, medialize it, and put it over here. Guard is used by inexperienced surgeons and usually avoiding the spillage of the tissue. Knelton tubes, nasogastric tube. Although both have the same color represents the same diameter. The color represents different diameters of the Knelton tube. NG tube is large as compared to the Knelton tube, and it has got diameters mentioned over here, distance mentioned over here. Secondly, NG has got a blue line. The blue line represents radio opaque line, which can be seen during an X-ray. Remember, the tips of the Knelton are blocked to avoid vigorous suctioning or trauma to the suctioning area. The suctioning can be done through the sides of the Knelton tube. In the same case, in few of the NGs, the tip of the nasogastric tube is open, which allows the fluid to go in to the body. Tilly's forceps. Tilly's forceps is used for nasal packing. Always remember, if there is a screw in between, that is going to be called as Hartmann's forceps. No screw here, this is called as Tilly's forceps. Remember this differentiating point. Dennis Brown Tonsil holding forceps and Lux forceps. Dennis Brown Tonsil holding forceps is used for picking the